Ara anem ja una mica agafadets de temps i passarem a veure un vídeo perquè malauradament tampoc ha pogut assistir del Rob Lowth. És director de la Housing First National Office del Ministeri per a l'Habitatge, Govern Local i Patrimoni d'Irlanda, i ens parlarà principalment de les adaptacions que han fet allà del Housing First i de les característiques del primer Pla Nacional d'Implementació de l'Habitatge. O sigui que passem al vídeo directament.
Thank you so much for the invitation to present at your conference. I hope it's a successful conference, and I will just cover a few points from the Irish implementation of Housing First. The origins of Housing First in Ireland date back to 2011, when Dublin City Council, working closely with an NGO partner, piloted the very first variant of the Housing First scheme, which was a direct response to an increase in rough sleeping in the capital of Ireland at that time. The initial scheme was a real learning curve for everybody involved, and it provided a deep understanding of the real requirements for Housing First, with only a limited number of about 20 tenants in the beginning for the first number of years. In 2014, the scheme was expanded, and it included the 3 other local authorities in the Dublin area. And the service was then at that point tendered by Dublin City Council to select a new NGO partner. The initial target at that time was only 100 tenancies, which might seem small in comparison to the 1,000 tenancies that we have nationally today. But it was a real beginning, and it was the first introduction of Housing First in the Rebuilding Ireland government policy, which actually increased that initial 100 target to 300 new tenancies over the period 2014 to 2018, which was significant. So this was the beginning of real change for Housing First in Ireland. Because homelessness was increasing. The issue of long-term homelessness, rough sleeping, was becoming more concerning to government parties. And the fact that they adopted Housing First in government policy was a real direction change and an important factor for Housing First in Ireland. And the fact that it was recognised and more importantly supported by politicians. It was a real game changer and a catalyst for what was to come in Housing First in Ireland. And after that initial period of 2014 to 2018 with the program and the targets, it was followed by new implementation plans and the start of my predecessor as a Housing First director, driving the program across the country. While the initial focus was Dublin, things started to change and developing Housing First around Ireland was becoming, I suppose, an important factor to see, and everyone else wanted to build on the success of what happened in Dublin. They could see the impact on long-term homelessness and rough sleeping, and they could see that individuals who never had the opportunity to live independently without wraparound support services were getting the opportunity, and the rest of Ireland actually wanted to see this happen. And today I can thankfully say that we now have 1,000 tenancies around Ireland, while roughly 50% of these tenancies are in Dublin. The remainder are in the other larger cities and towns around Ireland, and many in rural communities that would never have thought of a homeless solution being in their town or village. And that's a real testament to what Housing First has the power to deliver. In terms of the adaptations of Housing First and the model that Ireland has progressed with, Ireland adopted at an early stage the pathways model that was developed in America by Dr. Samson Beres. And I suppose from the point of view of understanding the reasons and the rationale behind that early adaptation lies solely in the heavily researched elements of the pathways model in America and the critical success factors and the positive health outcomes for individuals engaged in that program. While Housing First has taken on many various guises across Europe and the world, Ireland, from a governmental perspective, was an early adopter of the pathways model. And Dr. Samson Beres has been engaged by the Irish government to actually write a manual for Housing First, specifically based on the pathways model and on the high fidelity to that model. And I think and I feel that the success story in Ireland is not necessarily about 1,000 tenancies, which we're extremely proud of, but I think it's about the actual health outcomes and the individual impacts made on somebody's life who was never given an opportunity in the past by local authorities, by health services, because the public services weren't aware of the power of Housing First in that sense. And while we all often think we're part of a cult and a cult movement in Housing First, it actually is testament to the powerful nature of the simplicity that Dr. Samson Beres actually delivers when talking about Housing First. And he's remained a close ally of the Irish system from not just the government side of things, but from the NGO side of things as well, where we bring him over to provide training on the pathways model to enhance what he wrote in our training manual. So I suppose from the point of view of adaptation, Ireland is very focused on scattered site housing because we see the success of scattered site housing. It's not to say that Ireland hasn't adopted long-term congregated move-on supports for people who've been homeless, but it's just not been adopted formally in a Housing First setting. We understand and we realize that the percentages in Housing First that we hold an 85% success average, but we do realize the 15% of people who don't make it successfully in Housing First, we do need to provide housing solutions for them. And that can often be in congregate settings where somebody else is managing the front door for them, where health supports will come to them, and facilitations for hospital visits or hospital placements might actually be made. So I think from the adaptation, Ireland is firmly an adopter of the pathways model. But at the same time, we all as countries and unique entities and different race of people, we all have to adapt and localize systems such as Housing First. So I imagine what we actually do in Ireland isn't 100% the same as pathways in America, while we try and stick to a fidelity. The localization, I think, is important. Sometimes we need to have local workarounds for local problems. And I think that's very key to how we've approached the adaptation of Housing First as well. The implementation plans, I suppose they've been operational since 2018 originally. They've been extremely successful to drive targets, which has been the headline of many reports. However, they also provide a clear work plan, not just for the Housing First National Office, but also for regional homeless authorities that are established in Ireland. There are 9 of them around the country, and also health offices as well. So in terms of objectives, it helps measure and balance within the overall housing environment, because it's quite important. Without an implementation plan, Housing First would only be seen perhaps as one small part of the housing solution that's actually been driven in Ireland. But because of the footing of and the clear target set and the clear objective set in the national implementation plans, things have been a bit more coherent and stronger to actually promote this solution that is Housing First as well. They provide clear governance for the program as well, where the Housing First National Office, we meet with each region at the end of each quarter to review the operational performance, but also more importantly, to actually work together to fix the difficult parts of social services. I think we've all worked in social services long enough to maybe understand and realize not everything is simple, because you're dealing with personalities on the front line who are all different. And sometimes we need to fix part of our own services to actually be able to adapt and deal with that as well. Another key part would be the critical success factor that research has brought in terms of the implementation plans, and actually driving some of the actions in the implementation plans as well, and delivering the evidence to inform real change. And I think that's critical, because when you associate research with an implementation plan and you actually act on that research, you then can inform real change. And ironically, we're in the process of engaging further research at the moment, but we're taking on the form of action research, where you can have formal research, but the benefit of action research is you can target a key area and a key plan. So just to give you the example, where you have disengagement from Housing First tenants in the program, we're carrying out a piece of action research with our partners and our stakeholders across each region. So we'll have researchers working directly with the NGO, but directly with the tenants as well, to engage them as part of the process, to see why things have changed for them and where we need to actually go to make a difference and to improve that factor of the program as well. The implementation plans also allow the Housing First National Office engage with frontline teams in terms of the community of practice. So we run a community of practice each month, where we get the opportunity to feed back what's happening nationally, but also to hear from the teams that are providing the wraparound supports around the country, to hear directly some of their issues, some of their blockages. And this allows for a two-way street of communication to actually support the teams and support their organizations as well at a different level. So it's not just a top-down approach in the program, it's also a bottom-up approach as well. And this is something that we've encouraged in terms of engaging the process of funding peer support workers as well, to be able to bring lived experience into the Housing First program, which is a critical part of Housing First that was developed in the Pathways model in America also. So just some of the other key items in terms of the implementation plans, working with prisons for possible Housing First tenants who've been long-term homeless, and taking them directly from prison and rehousing them in the Housing First program. That's been extremely successful to date around Ireland in different communities, from a rural perspective to an urban perspective. There's no barrier in relation to this, but we've seen a key impact in terms of reoffending rates have been very low on the program when somebody is permanently housed. And we think that's quite critical. As I mentioned, the community of practice, and we've been expanding our community of practice. Research, we're always looking at different parts of research that we can either assist with or fund directly ourselves. Monitoring on a quarterly basis, rural engagement, digital harm reduction. The list is endless in terms of what we can actually do when we're working with a key implementation plan that's extremely targeted and extremely focused. In terms of the relationship between state services and NGO organizations, I need to give a bit of a background in terms of the legislation for the provision of homeless services in Ireland. Local authorities alone can't provide all parts of homelessness as a response. And briefly, just to mention the legislation that defines the need for key partners, such as health services, prison services, social protection, and child and family services. They're actually mentioned in legislation in Ireland, and the organisation that's charged with chairing this strategic management group is the local authority. And then to go further into giving an example, the funding for Housing First, the intensive case manager positions are 90% funded to local authorities by the Department of Housing in central government. And the 10% is made up by the local authority themselves. So as services increase and expand, there's a cost on the local authority. So while the specialist health resources, the clinical resources are provided by the Department of Health to the local HSE health offices, the strategic management group, in bringing all the key statutory agencies together, has the responsibility to request and highlight gaps and challenges faced by local service providers. And in the case of Housing First, the partnership and the association between health and housing has been extremely strong. But to mention, without the NGOs providing the key skills and the key understanding of what happens on the ground with homeless individuals, none of that makes any difference. So you could have all the funding in the world, but if you don't have the right NGO, you don't have the required partnership and real stakeholder management to deliver the service. So the relationship is critical between the state services, the local authority, the HSE, and the NGO. One of the most important things to highlight at this point, and something I've learned over many years of engaging NGOs, is the alignment of the strategic goals. So the NGO is providing a service, not just to the homeless individual, but in the first instance, they're providing a service to the state. And their goals must be aligned to the strategic goals of the state and to the local authorities and the health authorities as a consequence of that. So in Ireland, there's been a system of tenders and tendering for services. This is more or less developed over the past 10 years, I'd say going back to about 2014. And I suppose the tender service, while it can be a difficult process for the NGOs, it's important to be responsible for public projects, and Housing First falls under this category as well. But also, if you tender a project, it allows for that strategic alignment of goals and that management of the governance relationship with the NGO providers as well. So I suppose when you're dealing with so many entities and so many different state partners, it can be difficult in terms of managing the relationship with the NGO, because the NGO will automatically assess and deal with homelessness in their own way, because they often have fundraising to be able to deliver services themselves. But when they're engaged in state contracts, the relationship has to be a little bit more formal. And I think this relationship, while it is formal and it's a contracted arrangement, I think the flexibility and the understanding to realize that we're all working on one team, I think is critical. And we try to foster and harness that energy between the state and the NGO sector. And I think that's where we've been really successful within Housing First in Ireland, to actually capture that, because Housing First, ironically, has become the key mantra for most NGO organizations, because they realize and believe in what it's actually trying to achieve. So I think we've worked stronger together, and we've developed together over the past 20 years of what I would describe as the more formalized delivery of homeless services in Ireland. Best of luck with the conference, guys. Cheers. Bye.
See you guys.